When it comes to managing diabetes, choosing the right long-acting insulin can make all the difference. Lantus and Levemir are two popular options, each with their own unique features and benefits. In this video, we will compare Lantus and Levemir to help you make an informed decision about which insulin is best suited for your needs. What is Lantus? Lantus, also known as insulin glargine, is a long-acting insulin that provides steady, basal insulin coverage throughout the day. It is designed to mimic the body's natural insulin production, ensuring stable blood sugar control and reducing the risk of sudden spikes or crashes. Lantus has a duration of action of approximately 24 hours, making it a convenient option for individuals requiring once-daily dosing. Lantus comes in a multi-dose vial or a disposable pre-filled pen, allowing for easy administration. It is important to note that Lantus should never be mixed with other insulins or solutions. It is recommended to inject Lantus subcutaneously, under the skin, into the thigh, abdomen, or upper arm, ensuring to rotate injection sites to prevent the development of lipodystrophy, thickened or pitted skin, at the injection site. It is worth mentioning that Lantus is available in two different formulations: Lantus and Lantus SoloStar. Lantus SoloStar is an easy-to-use, pre-filled pen that provides a convenient and accurate way to administer Lantus. What is Levemir? Levemir, also known as insulin detamir, is another long-acting insulin used for diabetes management. Similar to Lantus, Levemir provides basal insulin coverage throughout the day, helping to maintain stable blood sugar levels. However, there are some key differences between Levemir and Lantus that may influence your choice. One of the advantages of Levemir is its flexibility in dosing. While Lantus typically requires once-daily dosing, Levemir can be administered once or twice daily, depending on individual needs. This flexibility allows for more personalized diabetes management, as some individuals may benefit from a split dose to better control their blood sugar levels. Levemir comes in a multi-dose vial or a pre-filled flex pen, providing options for convenient administration. Like Lantus, Levemir should be injected subcutaneously, and injection sites should be rotated to prevent lipodystrophy. Similarities between Lantus and Levemir. While Lantus and Levemir have some differences in their formulation and dosing flexibility, they also share several similarities. Both insulins are long-acting and provide basal insulin coverage, making them suitable for individuals who require steady blood sugar control throughout the day. Additionally, Lantus and Levemir are both available as pre-filled pens, offering convenient and accurate dosing options for individuals with diabetes. The pre-filled pens eliminate the need for vials and syringes, simplifying the administration process. Furthermore, Lantus and Levemir have been extensively studied and proven to be effective in controlling blood sugar levels in individuals with diabetes. They are both considered reliable options for long-acting insulin therapy. Differences between Lantus and Levemir. While Lantus and Levemir have similarities, there are notable differences that may influence your choice between the two insulins. One of the key differences is the duration of action. Lantus has a duration of approximately 24 hours, providing a full day's coverage with a single daily dose. On the other hand, Levemir's duration of action can range from 12 to 24 hours, depending on the individual's needs. This flexibility allows for more personalized dosing regimens, which may be beneficial for some individuals. Another difference between Lantus and Levemir is their onset of action. Lantus has a relatively slow onset, taking several hours to reach its peak effect. Levemir, on the other hand, has a faster onset of action, making it potentially more suitable for individuals who need quicker blood sugar control. Additionally, the cost of Lantus and Levemir may vary depending on factors such as insurance coverage and location. It is important to consult with your healthcare provider or pharmacist to determine the most affordable option for you. Efficacy and effectiveness of Lantus and Levemir. Both Lantus and Levemir have been shown to be effective in controlling blood sugar levels in individuals with diabetes. Studies have demonstrated their ability to provide stable basal insulin coverage and reduce HbA1c levels, a marker of long-term blood sugar control. A study published in the Journal of Diabetes Science and Technology compared the effectiveness of Lantus and Levemir in individuals with type 2 diabetes. The study found that both insulins were equally effective in reducing HbA1c levels and achieving glycemic control. However, it is important to note that individual responses to insulin therapy can vary, and it may be necessary to adjust the dose or type of insulin based on individual needs. It is recommended to work closely with your healthcare provider to monitor your blood sugar levels and make any necessary adjustments to your insulin therapy. Side effects and safety considerations of Lantus and Levemir. As with any medication, Lantus and Levemir may have potential side effects and safety considerations. Common side effects of both insulins include hypoglycemia, low blood sugar, and injection site reactions such as redness, swelling, or itching. Hypoglycemia can occur if the dose of insulin is too high or if there is inadequate carbohydrate intake. It is important to closely monitor your blood sugar levels and recognize the signs and symptoms of hypoglycemia, which may include sweating, trembling, dizziness, or confusion. If you experience hypoglycemia, it is recommended to consume a rapid-acting carbohydrate such as glucose tablets or juice to raise your blood sugar levels. Injection site reactions are typically mild and resolve on their own. However, if you experience persistent or severe injection site reactions, it is important to consult with your healthcare provider. In rare cases, allergic reactions to Lantus or Levemir may occur. Signs of an allergic reaction include difficulty breathing, swelling of the face or tongue, or rash. If you experience any signs of an allergic reaction, seek immediate medical attention. Cost comparison of Lantus and Levemir. The cost of Lantus and Levemir can vary depending on factors such as insurance coverage and location. It is recommended to consult with your healthcare provider or pharmacist to determine the most affordable option for you. In some cases, generic versions of long-acting insulins may be available, offering a more cost-effective alternative. It is important to discuss generic options with your healthcare provider to ensure they are suitable for your diabetes management. Additionally, some pharmaceutical companies offer patient assistance programs or savings cards that can help reduce the cost of Lantus or Levemir. These programs may have eligibility criteria, so it is important to inquire about them if you are concerned about the affordability of your insulin therapy. Choosing between Lantus and Levemir. Factors to consider. When choosing between Lantus and Levemir, there are several factors to consider. These include the duration of action, flexibility in dosing, onset of action, individual preferences, and cost. If you prefer a once-daily dosing regimen and value the stability of a 24-hour duration of action, Lantus may be the preferred option for you. On the other hand, if you desire more flexibility in dosing and a potentially faster onset of action, Levemir may be a better fit. It is important to work closely with your healthcare provider to evaluate your individual needs and preferences. Your healthcare provider can provide guidance and support in selecting the long-acting insulin that aligns perfectly with your diabetes control goals. Conclusion and final thoughts. In conclusion, Lantus and Levemir are both effective long-acting insulins used for diabetes management. While Lantus offers a 24-hour duration of action and stable blood sugar control, Levemir provides flexibility in dosing and potentially faster onset of action. Choosing between Lantus and Levemir requires careful consideration of factors such as duration of action, dosing flexibility, onset of action, individual preferences, and cost. It is essential to work closely with your healthcare provider to determine the most suitable insulin for your diabetes management. Remember that individual responses to insulin therapy can vary, and adjustments may be necessary to achieve optimal blood sugar control. Regular monitoring of blood sugar levels and open communication with your healthcare provider are key to successful diabetes management. Ultimately, with the right long-acting insulin and a comprehensive diabetes management plan, you can take control of your diabetes and live a healthy, fulfilling life.